Hey, it's Matt here, Midwest Medigap. This video we're going to talk a little bit about the different parts to Medicare. There's four main parts, okay? It's Part A, Part B, Part C, and Part D. And we're going to talk about all those here. And there's really two main parts to Medicare, or two ways you can get your Medicare coverage. You can go original Medicare, or you can go with what they call a Medicare Advantage plan. If you look at this chart here, most of our customers are going to go down the left-hand side here where you have original Medicare. Okay, and that's Part A, which is your hospital insurance, and Part B, which is your medical or doctor insurance. Okay, those are the two main horses to Medicare, Part A and Part B. So you have that, and then there's some co-pays and deductibles within Part A and Part B we'll talk about. But what you also want to do is if you're taking any prescriptions, you'll want to add on what they call a Part D Medicare prescription drug coverage. Okay, you can think Part D, D stands for drugs. Okay, that's your drug coverage. And then step 3 is decide if you need a supplement coverage, which a Medigap policy or Medicare supplement policy would come in and help pick up those co-pays and deductibles under Part A and Part B that is not covered for you. Alright, so that's what most people do. The other route you can go is what they call Part C, is Medicare Advantage, which what that's doing, it's like a HMO or a PPO program that you're assigned to a network of doctors in your area that accept these programs. So if you're one of those people that likes the freedom to go wherever you want across the country to any doctor, any hospital that accepts Medicare, you may not be a good fit for a Medicare Advantage program because you do have networks of doctors with those plans. So most of our customers, again, they like to go the original Medicare route and a Medigap policy for a little more flexibility and freedom. So let's take a look at some of the costs for Medicare, for Part A and Part B with the co-pays and deductibles. This is for 2018, so if you're watching this in a different year, these costs may have changed, but we'll try to update that as we go here. So if we look for under Part A, what you pay for Part A, if you've been working for more than 40 quarters here and paid your Medicare taxes, there's no charge to Part A premium, okay? There's no cost with that. But with Part A, there are some deductibles that you are responsible for. So if you just have Medicare and no supplement coverage, you would pay a $1,340 deductible for each benefit period per year. Days 61 through 90, you'd pay $335 coinsurance per day for each benefit period, and days 91 and beyond you pay $670 coinsurance per day after 91 days and beyond. So those costs can add up. Under Part B premium, the standard Part B premium for 2018 is $134 a month. It would be higher depending on your income, and we'll talk about that here in a minute. Part B deductible and coinsurance, you pay $183 for 2018 per year. Okay, after your deductible is met, you typically pay 20% of the Medicare approved amount for most doctor services. So basically, Part B, you think you pay the deductible, and then you're on the hook for 20% of the Medicare approved amount after that. Part C, again, that's Medicare Advantage. We won't talk about that here. We'll save that for another video. And then Part D, which again, that's your prescription drug coverage. Those monthly premiums do vary depending on where you're located and what you take for prescription coverage. So if you give us a list of your prescriptions, we can plug those in and give you an idea or an estimate on how much you'd be paying for prescription costs. That is also a lot of times based on your income, what you pay for your monthly premium on that, and we'll show you that here in just a moment. So your Part B, on what you would pay for that. Again, most people would pay $134 a month for 2018 based on your yearly income. Okay, if you file individual, here is the amounts on your income. If you're $85,000 or less, you'd be paying $134 a month for your Part B. If you file a joint tax return, if it's $170,000 or less, again, you'd be paying the $134. And then you can see as your incomes increase, the prices over here that you pay each month for your Part B does increase as well too. So just check on your taxes on your income levels, and then you can have a good idea of how much your Part B is gonna cost you. Be careful, there is a late enrollment penalty for Part B as well too. If you don't sign up for Part B when you're first eligible, you'll have to pay a penalty, and that may go up 10% for each full 12-month period that you could have had Part B but didn't sign up for it. So if you have any questions with that part, be sure to get a hold of us so we can make sure you're not subject or get stuck with having to pay any penalties on that end. And if we scroll down here again, we can look at, this is your cost for your Part D prescription for 2018. Again, based on your income, same thing if it's $85,000 or less. If you're individual, you just pay the monthly premium. Most premiums for prescription drug coverage, again, it depends on what you're taking, but most run anywhere from $20 to $30 or $40 a month. And so you would just pay that monthly premium plus whatever copay or deductible is associated with the plan. If you are $85,000 and up or $170,000 and up and file a joint tax return, you can see the increase there is $13 plus your plan's premium. So let's just say, for example, your monthly drug plan cost on the premium is $20 a month. Then you would just add $13 to that, so it'd actually be the $20 plus the $13, so $33 a month is what you'd be paying each month for prescription coverage. But again, that's something we can look up for you, what your estimate on prescription costs would be. That's all dependent on what you're taking prescription wise. So that just gives you a snapshot on what some of the costs are for the different parts to Medicare. You can go back, rewatch this video. I think it'd be helpful to maybe watch it a couple times, let this stuff sink in. And if you still have questions or concerns or anything that you need more information on, just feel free to contact us. Our 800 number again is 1-800-805-6834. And our next video, we're going to compare the different plans to Medicare Supplemental or Medigap and what they all cover, so you can see what costs are associated with those. So thanks for watching, take care, and we'll talk to you soon.